Okay, so this is after I cleaned it a little bit and let it dry. Um, and as you can see, what happened is basically because of the way the tam is, most of the liquid is accumulating over here. So this is the white stuff is what we were calling maceration. So there was too much fluid over there. So basically what happened is that the pad was protecting. That's why it's dry over here. This job what it was supposed to do over here, but I should have padded a little bit more over here because of the way that the tum is. A good point that is, you see, like I was using when we talk about gauze, I don't know if you can see that stuff here, but I was drying my finger with gauze, and look what it does. This is what gauze do to you when it stay to liquids. See, it's all over my thumb there. So I'll clean my thumb even a little bit better, and it looks like there's not that much. Well, there's too much liquid coming, but it's not that much for the pad because based on what the pad was look like. So I will be able to apply this and probably maintain it as I'll put something around it and have a smaller version of it. So I'll do that and I'll. Okay, so this is the AG. Yesterday when I bought this one, they didn't have the little one, so there's size like this, which is like 2x2 kind of, and then there's those big ones. So this is what it looks like. It's kind of dry. It looks like a gauze, but actually, if you wet it, it will become like more like a gel. And because there's a lot of maceration, meaning that there's a lot of liquid coming out, then it tells me that my dressing should be dry. So, because you can use this in two ways. If your dressing is if your wound is too dry, you can wet the dressing and it will create that gel. If not, you're using the liquid out of that the wounds will create to create the dressing. So that's why I will apply it dry. And then what I'm going to cover it with is a Tegaderm. I don't think I want to keep an eye on it a little bit closer now. So what I'm going to do is this will be a smaller dressing. A lot of people will think that to do a dressing like this, but the best way to do it is actually take a bigger one and to do it this way. So that's how I'm going to do. So this is a small one. So the small one, a lot of people will put it this way, but the bigger one, I'll be able to do the dressing I'm doing. So I'll do that. And okay, so I left the paper on so just so you see a little bit better. So you have different choice on the upsides or Tegaderm, dependent, but basically transparent dressing. Those dressing breeds is a little bit like some Gore-Tex. It kind of breathes and let the water won't go in, but the perspiration will go out. So I could have used a smaller one and do, like I said, a round thread. But instead, if you do a dressings like this, so basically almost like an H, and I'll take off the paper now so you can see a little bit more what it does. It does like a little butterfly. And what it does, so basically what you do is you put it this way instead of putting it around it. And so what this do now is that it offer a better protection and it stays much better on the wound versus the other way around, and it kind of gets moved. What I do usually is I add a little bit of Coban, and I probably won't use the big one now. I'll probably use just a small one, but you use like the 1 inch or whatever size it is, like this, and just at the end here I'll add a little bit. So this dressing provide me, so now you saw like what the dressing looks like before when I had this, and now this is the dressing. So this is what we call the window dressing, meaning that I can see what's happening. If it start and those things, by the way, you'll see as I progress, you'll see that it'll come black. It's normal to do that. That's the dressing doing that. Because the first time I used that, I kind of freaked out a little bit because everything was black. But this is normal. It's the silver activating. So what this will do is that if the wound becomes a little bit more, if there's more liquid coming out, this dressing will obviously fall down and I'll be able to see. So that means that I have to change my dressing. The other ones, just like usually the first 2 or 3 days, there'll be a lot of liquid coming down and stuff, and so you need to assess how much, because it depends on how much damage and stuff. The skin under looks very nice. It looks red, as you could see on the. So that means like there's a healing process. Like I said, now just by touching here, it's not painful because like the air is up. So that means like nerve and the skin is getting all the layers that it has to. I did remove a little bit of the protective skin that was on the top of it because it was getting a lot of maceration, and maceration equals infection. So I took that off now because it doesn't need, because that little layer of skin that I was talking to you about to protect was starting to build. That's why I don't feel as much pain and don't feel the stuff. So that's why I took that layer off, because now it was becoming more of a risk of infection. So that's what it is here. So it's called debridement. So basically you're taking off, but the skin here was becoming a little bit more of damage more than anything. If you wouldn't have those dressings, then the skin would have to stay, but this better contact it has with the wound himself, better it is. Because like I said, it will create, so basically imagine that I have an empty lake. This, what it does, it will fill out those gaps, and will take every little details of the wound, like even if there's like little microscopic little wave, this will take the shape of it, and so that way the wound will be able to heal down up. And like I said, is that now with this dressing I'll be able to see, and also if it becomes a little bit more, if there's a lot of liquid coming out more than I expected with this, then I'll be able to assess, change it, and then maybe go with another dressing, something like a Mepilex border, which has a little foam like I had before, and Mepilex inside. So that means that it won't adhere, and so I'll have maybe another layer of this plus this, so that way all the liquid will be able to absorb, but this will still creates the soups that it wants. It's not recommended to cut the AG that like I did, because as you can see, there's it gives like little filament, and this will become, it lose a little bit of its stability, but sadly that's all I had was those big ones. So and it's a small wound, so, and it's not like I'm packing it up, so we'll use it for now. And so like I said, I'll put a band of a coal band here, and then maybe even go up a little bit just to protect it a little bit. And but this right now, as it is, I could go and take my shower this, because this is now waterproof as well. So by covering the bottom part there, now even if I wet it or something, it will be protected. I'll just add a little layer just so it looks a little bit better and people don't ask me too much questions. But otherwise it's all good. So we'll see you on the next video and see how this puppy is healing. So for now, because now I can see, I'll probably leave it as for the next 4 or 5 days and reassess in another 5 days, see how the healing is going and stuff, and again doing another dressing. Probably I'll add another AG to it until it completely heals and looks like normal. So I'll talk to you soon.